Good morning, everyone, to our roundtables. This is Thursday morning in California. You can see the poppies. I'm Eileen Serlin. I'm hosting today. And I want to welcome everyone and say that people will be coming on during this time on our Zoom link here. I'll introduce who's on the screen with us today. We could not get the Facebook link going today, so we're recording this session. So those of you who know that, the link will come out soon and we can see this conversation at any time afterward. So here I am in San Francisco. As you can see the poppies, and I'll just introduce here who's on the screen for now. See Dr. Marilyn Safir from Haifa, Israel. Dr. Alan Enton from Philadelphia. Richmond, Virginia. Dr. Eleanor Pardes, who's coming in from Israel, from Tel Aviv area. Dr. Eric Pepper, as you can see with the mountains, from the Bay Area and here in California. Dr. Patricia Valencia Carrillo from Madrid, Spain. Amy Lee, who's coming in from the Bay Area. And Brittany, who is coming in from Pennsylvania. Is that right? So we have people coming in from really all over the country and all over the world, and other people will be popping in as we go. I would like to just start off with an introduction to the topic. So let me just say that when COVID hit, it was March, way back at the beginning, a colleague of mine came back from a conference, an office mate of mine, who just came back from New York conference, and I hugged her hello. And then the next day I found out that she had tested positive for COVID. So I spent, at that time it took 3 weeks for test results, really thinking, what would happen if I got COVID? And back in those days, it was really, really serious. And I had just a little bit of a sense of what we're going to talk about today, death anxiety. I really began to think, what would happen if here, quarantined in my home, this was it? And one of my favorite poems, which Dr. Pardes reminded me of, I just want to start with that because this is where my thoughts were going those days. Home is where one starts from. As we grow older, the world becomes stranger, the pattern more complicated of dead and living. Old people ought to be explorers. Here and there does not matter. We must be still and still moving into another intensity for a further union, a deeper communion through the dark cold and the empty desolation, the wave cry, the wind cry, the vast waters of the petrel and the porpoise. In my end is my beginning. T.S. Eliot. So with that, like probably many of us, my thoughts turned to what we now know as death anxiety. And so I invited my dear friend and colleague, Dr. Kirk Schneider, to lead us in a discussion about a topic that's rarely directly talked about during COVID, but is really hovering over many of us. He has written many books, a leading spokesperson, as you heard, for existential humanistic psychology, and currently candidate for APA president, previous presidents of Division 32 and many associations. He'll tell you more, and many books on this subject. In the slides, you can get his contact information if you want to continue further. So our format for today, as usual, is we'll have a brief presentation, and then we're all welcome to join for a discussion around this topic. So Kirk.
Well, thanks so much, Eileen, and thank you very much to the task force for providing this opportunity to talk about a theme, as you said, that I think is ironically underappreciated in our field. I do want to share the screen here. So briefly, let me get this up. Okay, so I'd like to propose that we exist on many levels. That, as the philosopher and psychologist Maurice Merleau-Ponty put it, we are a network of relationships. And I'm providing this as background to move toward our focus today, which is on death anxiety. And I view that, and many existentially oriented researchers, theorists view death anxiety as really the context about which many of the other anxieties seem to arise. But circling back to this network of relationships, as Merleau-Ponty puts it. So I appreciate this idea because maybe it helps us to understand how we're related to various aspects that we address in psychology. For example, our relationship to physiology, which is often treated by drugs or some form of somatic care, support, our relationship to our outward behavior, which is often dealt with through behavioral therapy, relationship to cognition, or our intellective sphere addressed by cognitive therapy, relationship to our family system, often addressed by psychoanalytic family therapy systems, relationship to culture, addressed by hopefully culturally proficient approaches. And at the sort of apex of this network of relations, or maybe at the hub of this network, I see our relationship to existence, our relationship to all that is, to being. And this raises very profound questions about how we live, the whole question of how are we willing to live, given our very challenging relationship to just being, appearing on this earth, and relating to the mystery of our path in life. So this is where we locate death anxiety. And we find that for many people, it is optimally addressed through experiential, existential approaches. I think what I'd like to underscore here is that these, as we move toward a deepening of our relationships and our relationship to existence, I'm seeing that as perhaps the deepest. It's harder and harder to place categories and words on it, or to explain it. And that's where the experiential mode is so important. It's about, often it's addressed through metaphor, people feeling like they're drowning, or they're in a black hole, or in a bottomless pit. It's often addressed through a nonverbal and kind of kinesthetic mode, as opposed to some very programmatic approach. So I don't want to get too much into that right now, but just to give you a sense of where we're coming from in the context of other approaches. So one side of our relationship to existence is death anxiety, as I say. Another side of our relation to existence could be potential liberation, resilience, which I'll get into more. I mentioned that death anxiety seems to underlie and inform many of the other more circumscribed anxieties that we experience, from the physical to the familial to the cultural. And not to downplay these are obviously very significant anxieties, but they're couched in this deeper relation. Death anxiety seems to take two basic forms as we see it in existential psychology. One, a literal physical form, the fear of physically dying, of expiring, and the other, a more symbolic form. And this is where this is what we see, I think, with people who are struggling with some of the deeper levels of their concern, and where we're talking about, the sense of drowning, or of being in a black hole, or being in a free fall. It relates more to identity loss, being taken out of our routine and familiar way of living. And of course, trauma of all kinds can bring those experiences about. A kind of rip in the fabric of the familiar and the routine opens us up to the radical mystery, the groundlessness of existence and of what we call death. So terror management theory and social psychology has brought a lot of this thinking to mainstream psychology through experimental research. And both the qualitative research in existential psychology and terror management theory have converged in many ways on this theme of fear of death and its symbolic implication. So terror management theory and existential psychology really address both physical death, as I was saying, and symbolic death, and what this brings up for people in terms of how it impacts their worldview, their political ideology, as well as what we'd call individual psychopathologies. And that relates to the basic survival fear, which relates symbolically to the terror of insignificance, of smallness, of invisibility, and of not counting. These all cluster around the theme of death anxiety. And in terror management theory, they tend to do a lot of priming of thoughts about death, images about death, and they look at how those impact people in terms of both their individual personalities as well as their worldviews and their political ideologies. And as you see here, these are some examples of what happens to people when they're primed for death anxiety or when they experience great traumas like COVID-19 and what that brings up. And I commend you all to not only think about, but try to experience and get a deeper sense of how COVID has affected your sense of being in the world, your sense of the familiar and routine and how it's taken you out of that. And how you react to that. Are you able to work with that profundity of relationship to the mystery of existence, the terror of existence that it opens up? Or, do you feel you have to react against it? And that's a lot of what people do, and that's why we tend to become rigid, what I call polarized, or the polarized mind. We tend to fixate on a single point of view to the utter exclusion of competing points of view. And I believe that that theme crosses over from political ideology, worldview, cultural identification to what we call individual psychopathologies, like depression, isolation, withdrawal. So here just kind of a brief discussion of means of addressing death anxiety. I really see presence and what some call mindfulness. I do think they're often defined differently. But these are at the fount. These are key to addressing death anxiety, especially at the deeper level. By presence, I mean a heightened awareness of one's being in the world. Mindfulness is often confined more to heightened awareness of the individual's thoughts, feelings, body sensations, and a capacity to observe those without getting overly attached. Whereas presence I see as more encompassing. It includes that, but it also includes our participation in the world, our participation in relationships. And I think there's also a little bit more of an openness to struggle with presence, whereas mindfulness often gets associated with detachment. But it seems to me that the bottom line is they both converge around being able to experience the more of who one is, rather than getting stuck and over-identified with a particular point of view that's fear-driven. Some very brief examples, and I talk about these in a couple of articles that I'll reference momentarily. But I think people like Viktor Frankl, Stephen Hawking, Maya Angelou sort of set the bar for dealing with some of the most profound death anxiety imaginable. You think about Viktor Frankl in the Nazi death camps and how he was able to tap into the more of who he was beyond the horrifying depravity of his circumstances by being able to, for example, picture his wife on a sunny day and the radiance of her smile, and just how that even momentary glimpse shifted his experience of the horrors of his situation. Stephen Hawking, just gravely ill, gravely disabled by ALS, and yet was able to connect with the amazement of the cosmos, and how much that buoyed his capacity to live and to experience a fuller life in such horrific circumstances. Maya Angelou, who was raped at 7 years old, but who somehow found the library and readings of classic literature inspiring her to see the more of who she was beyond, a horrifying, degraded position of being raped as a small child, and gradually was able to come into the more of who she was. And again, to experience the fuller ranges of living. That's really what this is about. Because kind of the flip side of death anxiety is, as I was indicating, a greater freedom, a liberation to experience the good, the bad, and the ugly, the fuller ranges of our thoughts, feelings, sensations, our fragility as well as our resilience. let's see. So I'm pointing to that with some of these other themes. These are other ways of cultivating that, that ability to experience the more of who one is, even with the death anxiety, through contemplative, creative, socially constructive activities. I've been involved in healing dialogues. We can go into that maybe in our discussion. I find these as ways of working with the death anxiety, the great fears that are brought up by people who have ideological differences from us, and supporting people to work with one another more as human beings rather than labels or stereotypes. So the notion of developing a larger, more flexible identity, part of this. I mentioned depth psychotherapy and other modes, as you see. Basically, the idea of encountering and integrating the fears of death and groundlessness, which can then be broadened into a deepened capacity for choice. It's hard to have a deepened capacity for choice if we're blocked off in so many areas and we're so fixated and stuck on single points of view to the exclusion of other points of view. But if we can be more present, more aligned, more connected with our whole bodily experience, we have a greater capacity for freedom within and without. So with that, I'll move to just some references that may be helpful for you. We'll give background to this. A lot of it derives from Ernest Becker, who I see as at the fount of much of contemporary existential thinking, certainly about death anxiety, but also about capacity to encounter it and develop a greater sense of awe toward living, humility and wonder, sense of adventure toward living, which echoes my latter points before, and some other literature that I think would be helpful. That book by Shaver and Michelintzer on meaning, mortality, and choice is a great collection of essays on terror management theory and its explication of death anxiety. Goes into many aspects of it: terror of insignificance, of helplessness, of not counting, and how that relates to a whole range of disturbances, from, again, cultural and political polarization to terrorism, to extremes in what we call psychopathological states. Okay, I'll end there. I know this is an awful lot, and I'm sure there's much that you'd like to discuss about this. So should we turn this over to?
Thank you,
More?
Dr. Schneider. Kirk, let's unshare the screen. We can go back to the gallery view. Great. And then have our discussion. Wonderful.
Thank you.
Thank you so much. All right, wonderful. We now open the floor to a discussion about this. You're welcome to chime in. Eric, if you can raise your hand, I'm happy to call on you.
Good to see you, Eric.
Well, pleasure, Kirk, and thank you so much for the summary. There were really three thoughts that came up for me. One, which is really the role of age, because I think there's a real difference in experience for young children who may be dying. They may not have that same anxiety. It's just different. There's something I've noticed in just total acceptance, the parents who have it. So what is the role of aging? I think that's one question. And the second, I think, and the other one, really three components, the question of culture, because if you go to other cultures, death is seen as different. I go to, totally different. I don't know if they have a different experience, but I just for any extreme sense, think of the people who become martyrs in terrorist bombing, and they may go to meet Allah, or something like that. They don't. So how do you explain that? And the third one, and here I think of the book by Younger called Tribe. And the major part to me is that some people, if I look at it, we have a kind of norm. I'll call it a normal curve in some sense, where some people have high def anxieties or those conflicts at many ages, and some have none or very little. So
In
what is there
tribes?
about the resilience? What is there we can do with young children, with college students, so they develop the skills or the internal strength by which they can transit these life changes?
Great questions, all of them. Well, to take your last one first, I believe in the presence of parents and of caretakers and of teachers and of mentors, or as Alice Miller put it, helpful witnesses. Now, Maya Angelou found that in the library through reading. She felt witnessed through those works. But yes, I think people who bring to children, who offer to children great conversations about films, about books they're reading, about their feelings, their struggles with traumas that they have, can be invaluable. The point is for the child, like the adult, but certainly in a different way, to be able to come into, again, the more of who they are beyond the identification with the fear. And one way to facilitate that is by being in relation to someone who has had some similar experience of great pain, difficulty, but who it provides a model for that child as one who definitely recognizes it, takes it seriously, but who has also found these other ways to venture out into life, to take risks, to enjoy other aspects of life, and can offer that to the child, again, through great conversations. Often with kids, it's through play, it's through contact with nature. I'm often fond of referring to the great times with my own son, in the ocean or in woods, on adventures. I believe so strongly in that, and in my own background, that was so helpful. That tactile contact with life, awakening me to more, and with the support of people who brought that to me. So as far as your questions about culture, definitely this is an issue that we need to keep learning about and expanding on. For sure, our culture handles death anxiety different from other cultures, but I think it's still not clear that any particular culture has, let's say, overcome the problem of death anxiety. It seems that some cultures handle it better, if you will, which means maybe in a more composed way, or it's more part of their natural way of living. It's incorporated into their natural way of living. But still, it seems that we all, being flesh and blood creatures, get scared at times. And there are profound physical and mental, emotional issues that come up for all of us, and that those seem to drive certain, I guess you could say, typical kind of patterns, like becoming polarized again, becoming fixated on single points of view, narrowing perception. And we see it manifesting in different ways. You mentioned some Middle Eastern cultures believing in, achieving immortality and afterlife, and we have that in Christianity as well. Is that, I don't know if it's clear in some cases. Well, I don't know how clear that is as to whether that is some degree driven by death anxiety, fear of one's vulnerability and smallness and insignificance in living, or how much it's a part of having a more holistic and encompassing view of life and death. But certainly, again, in the extremes where we see violence, ideological extremes, the studies indicate that often these people have been traumatized culturally or individually. And in many ways, they're overcompensating for a terror of not counting, of not mattering. And so they can connect with these very immortalizing, transcendental sort of worldviews, and also find scapegoats to raise themselves up. Because that's what death anxiety seems to promote, needs for safety, for certainty, for safety and belongingness, and for a sense of uniqueness and power. And that uniqueness and power is sometimes an individual inflation, but it can also be vicarious through other powers, like ideologies, like strong-arm leaders, etc. So I realize there's a lot in that, but I think we're still investigating how cultures are viewing death anxiety differently. And I don't think we should be too rash in assuming that one handles it so much better than the other, because we've seen so much disaster through history. In my studies of the polarized mind, it crosses just about every major culture and power center through history. So as far as aging, yes, certainly differences in response to death anxiety. But I can tell you, I experienced it as a very small child when my brother, 7 years old, died of complications, physical complications. And I was about 2.5 years old. And I'm not exactly sure what you were getting at in terms of a child experiencing death anxiety radically different than an adult. But I certainly experienced a sense of groundlessness and of being overwhelmed by the vastness of life and of the cosmos and of the, horrifying possibilities that they present to my physical being. And they manifested in, fear fantasies often, monsters, witches, the dark, etc. So, that would be an interesting conversation to pursue that more. But I see those kinds of themes coming up in depth therapeutic situations where people are getting at the most threatening aspects of their fears. Again, alluding to being in a black hole or a bottomless pit or a free fall.
No, I can totally agree. I guess what happens is I know some people who somehow have been remarkable, who appear not to have that fear in that sense, even when they die. And I'm intrigued in that. I mean, I know, and for them, they're very full, let's say more actualized or not, who knows? And I'm intrigued in that. I know a number of clients I've worked with who, for whom I would say a few. Some have terrors, I realize, and some sort of, they don't have it in that, as best as I can sense. Yes, it's a transition. And I know when my parents died, I mean, my mother had zero fear, I can tell you, as best as I can tell. She was pleased to let go. And so and for my father, the same thing. So when I look at that, I say, yes, maybe we should ask the question, how can we, which is the part you're looking at, how do you make these transitions so people are peaceful? That's the whole part of the hospice movement, for example. And so I guess intrinsically, I would like to see it as a growth model. So it's like post-traumatic stress model.
Yes, well, that's very much what I was trying to emphasize with means of addressing it and some of those exemplars I brought up, like Frankl, et cetera.
Let's move on. Kirk, let's move on. I'm sorry to interrupt, but I want to give other people a chance both to ask questions. And I know that Eleanor, give me just a second, has prepared some comments.
Good.
And Alan came on for this, Alan. And so let's make sure everybody has a chance to speak here. Eleanor, if you want to make sure if you've delivered some.
I'm leaving aside. It's beautiful, and I really was inspired by the presentation and the dialogue also, which really brings into my mind the growth through the paradoxes. And I love the way you were talking about witnessing and the helpful witness. I think it has to do with our sense of witness, being with each other, relating with ourselves and with each other and connecting. It just had a sign here, your internet connection is unstable. Okay, my internet connection is unstable, but I think many of our connections are unstable and in a very unstable world. And I think I love your idea of the fluid center. And we really experienced that during COVID, and I think also in what we call the new normal or the new normal. And speaking from a country that I've been traveling now to the States. I came back the day before yesterday, and different places, and I've been to Florida and I've been to New York, New Jersey, and the world seems very unstable in all places, but it's dizzying, really, that dizziness. And I was thinking about how we need that fluid center in all this dizzying change. And you mentioned the wonderful book, Mortality, Meaning and Choice. I think it's been very difficult to make choices now. So I would really like to hear about the implications about making choices. And I love that you talk about what has been lost and what can be recovered. I'm not making any questions because I know we have limited time, but I'm really curious in reading more of your work on the mattering and the sense of the paradoxes and how this goes also with, I think Eric was also talking about old age and the way the elders who once, they also face and how it has been a very different experience. And last, since we're in the IPV, the domestic COVID IPV, I think that really the polarization is a very important issue. And we see so many protests. And I think the paper you mentioned from the Humanistic Journal also shows how there's so much paradoxes that even in those protests, which were supposed to we say that we avoid the death, the anxiety by linking to meaning, but here it is that in linking to culture, linking to meaning, linking, I've been seeing, all these religious ceremonies over the weekend and, mass gatherings, and here people are in threat of being contaminated. And they are in, actually with police, they're in other dangers and risks. And I really think there's a huge paradox there that the writers write about and that you've also been talking. I think it's very relevant and very, very important for our work in violence.
Yeah, I really appreciate that, Eleanor. And what it brings up for me is the question of whether the ideology, the view, is fear-driven, basically, a reaction formation, if you will, against a sense of smallness, insignificance, helplessness, or whether it's more centered, more deliberative, and reflective, coming from more deliberative, reflective position. And I think in order to get to that, and this addresses Eric too, that often there's some mediation is necessary, whether that's therapeutic, contemplative, religious sometimes. But these questions, aren't always so clear in terms of, you know, whether somebody's more fear-driven versus deliberative and affirmation-driven. It looks like there's another question from Patricia.
Well,
ahead.
I just want to make sure Alan, who's just joined specifically to talk with you, has any questions or comments.
Well, I do. Okay. What it brought up for me, and maybe for other people like Patricia, who I never met before, and is that I know a lot about the Spanish Civil War. And my uncle, as many as 3,000 Americans and 30,000 to 50,000 volunteers went to Spain to fight on the side of the Republicans against Franco, and always have thought about what were their motivations, their reasons, and now in the light of what Kirk has been presenting, you know, their whole thinking when they went to volunteer and against outrageous odds, against outrageous enemies, were very altruistic in their motivations. So it just raised you know, I don't know how I could study that, but it just raised a lot of questions about the volunteers who went. So thank you, Kirk.
Yeah, thanks, Alan. So it sounds like you're working with these themes of how much was fear-driven, how much was more deliberative.
Yeah, that's what you made me think about.
Yeah.
Amy, I know you've been trying to speak. Oh, and then Paul came on. We need to give him a chance too. Hello, Paul. Amy, go
Yeah,
ahead.
so I have questions specific relate to the death that is different in COVID versus any other times. My ex-boyfriend's grandparents both died in New York in a nursing home when they moved patients in there. And I believe there was no funeral. There was no way to even get to them. And then I have two other friends. One, the father died. She struggled trying to get a hospital to even set up a phone call where the phone could be directly talked to the dad, while the dad was very sick and then dying. There was another patient advocate expert that I connect with at Stanford, lost her husband. And she managed to have them set up an iPad where she could have some conversation with the husband during this whole dying process. But she couldn't visit the hospital. She even, bring this up to all the way up to WHO. She still couldn't visit the hospital, and so obviously she couldn't be there with her husband when he died. And I remember when my dad passed, from cancer, like all my family were there with him, right? And having that moment to be with your family member when they're passing, so important. Have a funeral where you're able to recognize them and cry and whatever, like official way to say goodbye. It means so much for family, and this is not possible for COVID, right? And so I wonder what is the impact, I mean, for the passing and also for the families.
It's a great question. It speaks to the question of being able to grieve, to in some way process such profound loss. And I'm right with you about being able to experience the death of someone closer. My mother passed away just several months ago, and I had that, a paradoxical, amazing opportunity to be with her every moment of it. But yes, what happens when you can't? Seems to me it's part of that problem of great loss without any mediation, without capacity to take some time to be able to be present, to the experience, to integrate to some degree the experience. And integrate is a pale word when it comes to death, obviously. But it's a lot more than just being cut off with no real opportunity for that kind of connecting and connecting with one's whole being as well. I imagine there's a lot of fallout from that.
May I introduce a new colleague, a friend who has just joined, Dr. Kimmel. Paul, can you hear?
Oh, Paul.
If you unmute, and I don't know if you were here for the whole presentation, but I think he also came on to hear you.
I did hear it all.
Hi, Paul.
I was blacked out because I was going back and forth to the House hearings on DC statehood, which has turned into a bureaucratic morass. I mean, they're considering bills from Homeland Security now, in addition to and in conjunction with the statehood, but that's another side of the world. Yes, but I did hear the presentation, Kirk, and I thank you very much. And particularly, Eileen, I want to thank you for giving us this opportunity for these forums. I saw the one last week and I thought that was very good. And I like this one very much also. My background, maybe most of you don't know me, is in social psychology. And I've worked for a long time with people like Edmund Glenn, Bryant Wedge, Robert Coles, that some of you may know, who have worked with people from different cultures. But the way we use culture in social psychology is slightly different than a cultural anthropologist, or maybe even what you were talking about would use the term. We wouldn't study it by going there and looking at what they're doing and how they dress and how they eat and things of that sort, although that's all relevant. But we're much more interested in their cognitions in the sense of where are they within the scale of socialization. And I've written a couple pieces on how people are socialized, and I call it subjective culture. And so, for example, the infant starts with no culture subjectively. It's a I need, I want, I get, and I call that chauvinism. And then most people then move into the next stage of identification with their own group, which we call ethnocentrism. And a lot of people get stuck there, unfortunately, and that leads to a lot of problems. But beyond that comes tolerance. And now we get into religion. And what I want to do is understand everybody, but my purpose is to get them to think like I do, because I know I'm right. And then from there, you can go into science, where you say there is a certain set of data that we could look at, and that would take us beyond just tolerance and get us in touch with the real world. All of those are somewhat studied and by psychology, sociology, and I don't pretend to be a clinician. But the next stage is where I work with Edmund Glenn, who was the chief interpreter for the State Department. And he told me all kinds of stories about cultural awareness. And by that he meant, how well do you understand the basic way you perceive, reason, take in information, and communicate information? These are fundamental things that are different in different people. You literally don't see the same world. Your mind doesn't function in the same cognitive way. And he came up with some paradigms which we used in trying to train people going abroad. And that's where I met a lot of different people. Mostly we got Americans and frequently military or diplomatic people who were going to go overseas for the first time. What do you do with them? You know they're going to have culture shock, and particularly the families. And how can you help them? And so they devised a role play where Mr. Khan, who was an actor, a very good actor, played the part of the contrast American. And so we took what we thought were the characteristics of the typical American, probably somewhere between ethnocentrism and tolerance. We didn't get too many scientists. And we tried to contrast when they would try to solve a problem that we presented to them. in discussion with Mr. Khan. Mr. Khan was our actor, and he would give them the opposite. So if they were being deductive, he would give them inductive. And he'd say, that is not correct. That is not proper. You do not understand. And if they went from abstract, he would give them concrete. And eventually the idea was to get the trainee to see that they had certain assumptions that they had never uncovered. And if we could move them up the scale more toward the next stage beyond science, which we call cultural awareness, that's subjective awareness of your own set of assumptions, perceptions, and reasoning processes, we felt we equipped them better to live and work overseas. So instead of carrying their culture there, they were open to sharing their culture and listening better.
Interesting.
So that's the kind of culture I'm interested in. And I wonder if that fits with you.
Yes, very much so. It resonates for me in terms of capacity to experience the paradoxes of living, a both and rather than either or view, which is much more discovery oriented.
Yes.
Much more conducive to enlarging cultural and individual consciousness. I think that's very much what it's about. And where we get into problems is when we start segmenting, especially in absolutized ways, this way or that way. And I think that's often driven by death anxiety, frankly, at bottom. You know, a terror of not counting in some way or being wiped away.
We have limited time. I want to thank everybody and make sure Marilyn has been trying to.
Looks like Patricia also had her hand up. But
Well, let's go quickly so we can end pretty much on time.
I wanted to thank you for a very interesting talk and just mention my experience of being an elderly person and the anxiety that was inculcated in the beginning, where the feeling that you are so at risk. And one of the things that I find interesting is that there are still people that are staying in their bubbles. I mean, we know much more about COVID, but they don't seem to be able to free themselves. They don't go outside. They don't interact personally with other people. And I wonder how you would make an, shake them out of it.
well, yeah, I think a number of the modes that I was describing earlier of in some way supporting those folks to find a foothold in their fears, so they aren't so overcome by the fears. And how to do that? Yes, again, depth psychotherapy, perhaps developing a meditative practice of some kind where they're not as thrown by the fears. Maybe reading people like Viktor Frankl or Maya Angelou, or even Stephen Hawking. You know, how did these people assimilate such overwhelming circumstances?
I think part of their problem is the lack of awareness that what is going on in their lives is a result of this death anxiety. That's the problem, making them aware that this is the
it's operating. Yeah, that death anxiety is operating. Yeah, good point. Just making them aware of that could be a step in that direction.
Patricia, last but not least, final word.
Thank you so much, Kirk, for your talk. It's been very inspiring. And I think you did a great job trying to show us all the stages of death anxiety, not only related to your being, also cultural, daily lives changes. And I am a trauma therapist, and I work with kids, mostly with teenagers. And when this morning I spent 2 hours with a kid, the first assessment, and she wanted to die. And I have been having this kind of problems with, patients that before COVID and during COVID. And when I listen to lower down our fear, anxiety, you never know when you work with suicidal clients or patients. And so that's one thing that comes up to my mind. And also the stages of your life. And also kids have been affected, impacted by COVID. And you never know, you try to, depress kids. It has impacted, all kids and teenagers and young people. And also definitely all the elderly. And we have to pay respect, especially, thank you, Ellen, talking about the civil war. And here in Spain, many, the elderly that have been kids of the war are now in how you call it in English, in residence, housing, especially for elderly. And yesterday I talked to one of my colleagues who is a geriatric psychiatrist, and she said I have one patient in common, because I also take care of adult trauma patients. And we have this person who is over 70, lots of physical problems, wheelchair, and he's been depressed, and they have stopped seeing their families, and their routines have stopped. This is some kind of terrible life changes, and that and she said that when she listened to this patient, she was about to cry, and she's been having elderly in her office coming, and she feels so sorry. And I feel so sorry for those that have been and are still waiting for somehow going through death and not being able, as Amy said, be in touch with their families, although there is technology, but we need, as human beings, being close to our loved ones, right? And so this is everything that you have talked and everyone talked today. It makes me feel that we need to be more humanistic, definitely.
Yes.
And I agree with Ellen saying that you're being a candidate will give psychology a deeper sense. We've been through all this good empirical research and so on, but we need this type of roundtables. Eileen, thank you so much for inviting Kirk. And I finish. Thank you so much.
Thank you so much, Patricia. And I just say very quickly that this is something that I've been promoting for a long time, a mass movement of depth healers and availability to these deeper kinds of connections with helpful witnesses, and also dialogue groups, having a chance to rediscover oneself with another person who is on a completely different side than they are, different background, what have you. I think we need an equivalent of a works progress program for depth healing and its availability to people.
I thank you, Dr. Schneider, for coming and sharing your work with us. And please, everyone, invite your friends and colleagues to join us in these ongoing conversations. Each week is a different theme. We have people coming talking about new technology and COVID in the prisons and all kinds of themes coming up. So stay tuned, and you'll get a flyer beforehand with, you know, the exact title and topic, so you can choose. So again, thank you, everybody. And let's send this link around. So
Thank you, Eileen.
And if you're not already,
you.
please join us on Facebook, COVID IPV, and Whole International Persons Approaches, which
The
is where all of
Facebook
this
link.
is broadcasted live.
Thanks for hosting it, Brittany. And those links have gone out. We've sent out the flyers, so everybody's got the links. Hopefully this will be posted there once we get it going.
And I was able to touch base with Dr. Gaviria, so we're gonna problem solve this new update and be hopefully back to live next week.
And we'll be able to put this on the Facebook links so that those people we sent out notices that they can get it on Facebook will be able to. Okay, good news.
Much
Yeah.
appreciation,
Take care,
Eileen.
everybody.
And everyone.
Thank you.
Good luck, Kirk.
Bye-bye.
Bye.